still pretty vague on it, but risk factor for progression of kidney disease. Now, involved in so many things, I feel like it is really hard to pinpoint.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kyogenesis, our supplements designed for people people diagnosed with chronic kidney disease. And I'm joined again today by the lovely Lindsey Zirker. Lindsey is one of the head renal nutritionists at Kidney Nutritional Institute. She is a gem when it comes to all things autoimmune related and kidney disease. So any of those sort of things, she's your master there. But she's also a master in all things minerals and kidney disease and just minerals in general. So we've been slowly working our way through the minerals. I know Lindsey's she's like me, a voracious studier and likes to go down rabbit holes, and then we have to pull her out after a little bit and say, Lindsey, come back to us. And then she tells us everything she found down the rabbit hole, which is what I love about her so much. So, Lindsey, thank you for being back on the podcast. Yeah, so first off, zinc. Tell me what, let's, for people out there that may not know anything about their minerals and things like that, give me the 101 on zinc.
Well, I think the reason that you and I love zinc so much, kind of like with magnesium, it's involved in so many different things. It's really a busybody. So a lot of times people may think of it as like kind of the more primary roles we hear about is its role with supporting a healthy immune system, and then its role in helping with wound healing. But zinc does a lot more than that. It's really important for cell growth and division. It plays a role with our taste and smell, which I think a lot of people have also recognized with recent things going on. It's really important for producing proteins and DNA synthesis. It helps with our metabolism and general functioning, and helps reduce oxidative stress. And also a recent one that I learned about in looking at the hormones and stuff, but uh, the the enzyme that helps your body regulate blood pressure, the ACE enzyme, it has zinc is a part of that. And so zinc plays a role with that. And I was like, well, who knew that zinc was, involved in blood pressure?
Does zinc play a role in kidney disease, in the fact that can a zinc deficiency be a contributing factor? And what does the body or the kidneys use zinc for? Is in part of their process? Is that something where if you get really deficient, you're going to slow down your ability to repair kidney disease? Tell me more about that.
Definitely there are some correlations. I feel like the research is still pretty vague on it. But some of the research that I've looked up specifically said that zinc deficiency on its own is a risk factor for progression of kidney disease. Now, because zinc is involved in so many things, I feel like it is really hard to pinpoint why that's occurring. Like if it's not able to help heal and repair tissue, that makes sense. Um, if you have protein and DNA synthesis inhibition, like again, kind of going along with that, but also zinc plays a pretty significant role in blood sugar management. So where we have diabetes is the number one cause of kidney failure, it makes sense that, if you have low zinc, then that's going to exacerbate things, because zinc helps with, well, they found that zinc deficiency is associated with reduced insulin sensitivity. Zinc is actually required to make insulin, and it also helps with the skeletal muscle and insulin signaling, where a lot of, that insulin is needed. So, yeah, kind of interesting with that, that, zinc is involved in so many other things. But I didn't find like really specific, you know, things
No,
with it.
they're
It's
like that
just,
with the minerals, aren't they? They're very like
yeah,
they do this, and they're really they work inside sort of as an orchestra of everything else.
yeah,
And like I say, zinc and magnesium, is it over 200 or 2,000 metabolic processes that they're involved pathways in the body, I think.
either, both.
It's a two with some zeros. I can't remember which one it is. No, it's a lot. And I know zinc and magnesium are the two biggest ones.
Hmm.
And it's interesting that when you are losing your taste, and you can probably explain this better than me, that we always say when people are starting to lose their taste, it's because zinc has been channeled into other areas that are far more higher priority.
Critical. Yeah.
Yeah, that's what I'm looking for. So zinc in taste is one of the first things that will go, because the
Hmm.
body, that's not as critical as maybe it is in some of these other biochemical pathways that it regulates, and so it's losing it there first. So when you start to see loss of taste and hair, which the body goes not really necessary to all the other enzymes, zinc has been reorganized in the body to really where else it needs to go. But really big signs. And fatigue was an interesting one. That's not one that I generally put together with zinc. So I was really fascinated, and it makes sense, of course, for you to put those as sort of the three big things that you look at with the diarrhea, the fatigue, and the hair loss, I think you said, didn't you?
Well, I think like fatigue is a difficult one because there's so many things that can cause fatigue, but where, you know, a lot of times, like let's say, we have a CKD patient, we're like really good about covering our bases with B vitamins and stuff. And then if they're on a lower protein plant focused diet, then iron is also typically covered pretty well, which is another one we typically associate with fatigue. And then, you can have fatigue from the buildup of uremic toxins or like any other number of things. But I feel like when those three things start together, because of zinc's role with regulating metabolism, I think that's why, you know, we feel that fatigue if it's not there. And then, we just are like, oh, you started having diarrhea, you had your hair fall out, and you're tired. Those three things kind of started around the same time. Red flag. Let's look at your zinc.
Thank you, Lindsay. That was educational as always. That's why I love catching up, because I always learn lots of new things. So thank you. If anyone's out there listening thinking, oh my goodness, this woman is the mineral expert, I definitely need to chat to her. I will put the details in below, but kidneynutritionalinstitute.org, right? There you'll be able to find Jessie Anna and the team and all the amazing practitioners they have there. Lindsay being one of the head ones there, doing amazing work with people with chronic kidney disease, and obviously looking at minerals and very much treating you as a person and not a disease, and doing all the integrative testing. If you want to know more about what we do, you can head to www.kidneycoach.com, and you will find us on Instagram and Facebook under the same handles with Kidney Coach. Make sure you hit subscribe and like. That way you'll get notified anytime we put up new info. And if there are any questions you have for Lindsay or any other minerals you'd like her to talk about, and don't worry, we're going to plop our way through all these minerals here, please put some comments below, and I will make sure to pass that on to the lovely Lindsay herself. Lindsay, thank you as always. Thank you for listening, and we look forward to chatting to you next time.